So we begin with next concept, that is implantation. So what is implantation? It is the attachment and embedding of the blastocyst into the endometrium. It establishes the maternal and fetal connection. Okay, so this implantation is the establishment of the maternal and fetal connection. What is the timing and site? Generally, it begins 6 to 7 days after the fertilization. We have seen the blastocyst gets formed by around day 5, and then once it is getting formed, by that time it reaches the uterine cavity, and then this process of implantation begins. So it begins by around 6 to 7 days after fertilization, but it gets completed by the day 10 to day 12. Okay, both the things you should remember: the time when it begins and the time it gets completed. Okay, so the time of beginning of the implantation is around 6 to 7 days after the fertilization. It's get completed by day 10 to day 12. So what is the site? It is the upper posterior wall of the uterus. That is the commonest site of enters the uterine cavity by around day 4 or day 5. There is a hatching from zona pellucida which is required. Okay, so what are the stages of implantation? The first is an apposition. Apposition is just the loose attachment. Okay, so apposition is the loose contact of the blastocyst with the endometrium. This occurs at endometrial pinopores. Okay, and this is a hormone dependent. The hormone which is responsible is a progesterone hormone. The next step is an adhesion. This adhesion is the firm attachment of this blastocyst to the endometrial epithelium. Okay, so initially there is apposition. This is followed by the adhesion, and this is mediated by the integrins. Okay, cell division molecules such as L-selectin that marks the beginning of the implantation. Okay, so there are mediators like integrins and cell adhesion molecules such as L-selectin. Okay, so next step is a invasion. So initially there is apposition, then there is adhesion, and next step is a invasion. The trophoblast differentiates into cytotrophoblast and the syncytiotrophoblast. This syncytiotrophoblast invades the endometrium. It secretes the proteolytic enzymes. Okay, so which type of trophoblast? It is the syncytiotrophoblast that is responsible. It will invade the endometrium. It will secrete the proteolytic enzymes. Then what are the trophoblastic changes? The syncytiotrophoblast erodes the maternal capillaries. They will form the lacunae, and that initiates the uteroplacental circulation formation. Okay. So what are the endometrial changes which are seen? You get a decidual reaction. The endometrial stromal cells will enlarge. There is an increase in the glycogen and the lipid content. It provides nutrition to the developing embryo. Okay. And what is the hormonal support which is required? The SCG is secreted by the syncytiotrophoblast, maintains the corpus luteum, and that is the source of progesterone secretion. Okay. Then there is a completion of the implantation. The blastocyst is completely embedded, surface epithelium is re-epithelialized, and early placenta formation begins. Okay, so from exam point of view, there can be if the implantation happens outside the uterus, it will lead to the ectopic pregnancy. If there is a defect in the invasion, you can get a placenta accreta spectrum. Then implantation window is around day 19 to day 23 of the cycle. Okay, so remember whether we are discussing with respect to the fertilization or whether we are talking in terms of the menstrual cycle. Okay, so implantation window is around day 19 to day 23 of the menstrual cycle as such. Okay, then IUCD will prevent the implantation. So what we should remember from the examination point of view, the first week is concerned with the cleavage, the blastocyst, and the implantation begins. Okay, we have seen the implantation begins at around 6 to 7 days post fertilization. It will get completed by around day 12. Okay, day 12 to day 14. Then week 2 is a bilaminar disc, the cavity formation, and the SCG. And third week is concerned with the gastrulation, the trilaminar disc formation, and the orgogenesis begins. This is just the first is a divisions, second is a bilaminar disc, and third week is a gastrulation. there will always be a question either on the gastrulation or the initial spermatogenesis or this oogenesis or the blastocyst or the morula. Okay, whatever we have discussed, there will be at least 2 to 3 questions. So that finishes the today's topic of implantation also.